Hi, everyone. I'm Lisa REAMS. I'm the Vice President for Programs and Services at Pima Council on Aging, and I'm coming to you live from my living room, which doubles as my remote workspace these days. I'm once again delighted to be your host for our show, PCOA Voices. Can you believe we're on episode 5 already of PCOA Voices? This has been a super fun show to do for all of you, and I'm so glad you're here. If you're just now joining us, for this series, we're glad to have you, and you can catch up on all the prior episodes of PCOA Voices either at our website, which is pcoa.org, or on our Facebook page. Now, the purpose of PCOA Voices is to bring Pima Council on Aging into your living room. We want you to get to know us better, explore issues that impact older adults in our community, and you can learn a little more about how we can help. So we hope to inform you, engage you, and have some fun along the way. If you're watching our broadcast live on Vimeo or on Facebook Live, you can interact with us via chat. PCOA staff are here to answer your questions, and they'd love to just say hi to you. You would just type in your comment or your question into the chat screen and push enter. So today, we talk a lot about what services PCOA can provide for this community. And one of the main reasons that we can do that is because PCOA is the designated area agency on aging for all of Pima County. And that designation means something, and it links us with a whole network of similar organizations across the state of Arizona and throughout the country. And today I want to explore with you more about what that means, to put PCOA in a larger context for you. So to have this conversation, it's my great pleasure to welcome the President and CEO of PCOA, Mark Clark, as well as our Chief Operating Officer, Debbie Adams, and our very special guest, Sandy Markwood, CEO of N4A, the National Association of Area Agencies on Aging. Welcome, everybody.
Thanks, it's great to be here.
So thanks for joining us to give us all a greater context about area agencies on aging. Sandy, let me start with you. Can you explain, give us a little history lesson. Can you explain what the Older Americans Act is and how area agencies on aging came to be?
Sure, absolutely. Well, Lisa, the Older Americans Act was part of the passage of President Johnson's War on Poverty. And back when the Older Americans Act was passed, almost a third of people age 65 plus lived in poverty. So it was a really necessary piece of legislation. And it was passed the same year, 1965, that Medicare and Medicaid were passed, but the Older Americans Act was passed first. So it was really a part of a national commitment on the part of the federal government to ensure the health, the safety, and the well-being of America's older adults. And it remains a very strong commitment to those goals even now. And when you're looking at area agencies on aging, even though the act was passed in 1965, area agencies were added to the act in 1973, and they were added to ensure that there was a delivery system in communities across the nation to deliver really necessary home and community-based services and supports that keep older adults living safely and independently at home and in the community. And there are a range of services that area agencies on aging, like the one here, the Pima Council on Aging, provide to millions of older adults in communities across the country, ranging from meal programs, transportation program, in-home supportive services, caregiver supportive services. Since 1965, the numbers of services have continued to grow as the older population has.
That is such helpful context for it. Debbie, I know that you've got amazing history working with area agencies on aging, and you've done that now for about 40 years. Can you help all of us understand what the primary roles are of an area agency on aging?
Yes, area agencies on aging play major roles in their community. And as Sandy mentioned, one of the beauties of the Older Americans Act is that the Area Agency on Aging can be a planner and a developer of services in their area. So as a planner, we go out to the community every 3 to 4 years, and we hear from our community, from older adults themselves, from family caregivers, and can really identify and determine what needs older adults have and how we put together that system of services that Sandy mentioned. We also, area agencies on aging, are an advocate. We give voice to the concerns and needs of older adults and their family caregivers. We work with agencies in our community to really develop those programs, put them in place, contract and partner with social service organizations to have those services that Sandy mentioned. We also do some of the services directly. We do our Medicare counseling, our rights and benefits counseling. So over the years, we've developed some programs that we do directly. And I think foremost, area agencies on aging are really a leader in their community and their region, in that I always thought of us as kind of the focal point where people can come and know that they can get unbiased, good information, where we will listen and we will look at how we can take the needs that they're identifying and how can we put services in place in the community to meet those needs.
That's a good overview, Debbie. Thank you. You know, as you just talked about, there's a core set of services that all of the area agencies on aging provide. One of the things I learned coming into this world quickly, and actually at the N4A conferences that your organization puts on, Sandy, is that the entities themselves that do this work and some of their activities vary really widely across the country. Can you tell us a little bit more about that?
Sure. You're right, Lisa. There's a lot of variety and variation in area agencies on aging, even where you'll find them and what they're called. You know, in about 27% of the area agencies are housed in county government, another 27% in councils of government, 39% in nonprofits, and then the remainder, you know, could be at a college or it could be in a community action center. So where you find them is different, what they're called, but what is essential is what Debbie just said, is that there are 5 core services that every area agency on aging in the country provide, and that's nutrition services, supportive services, which is a range of services that range from in-home support, chore services, transportation, and the like, health and wellness services, caregiver supports, and critical elder justice services. So no matter where an area agency on aging is in the country, they all provide those services. And again, area agencies on aging are everywhere in the country. Whether you're in Arizona or you're anywhere in the country, there is an area agency on aging there to support older adults in your community and also to support their critical caregivers.
We get that question a lot here on our helpline. Questions like, my mom lives in Boston. Can you connect us with the organization there that that does what you do? And we're always happy to help folks out with that. To take this from
Lisa, if I could just add in there, if someone is looking for an area agency on aging outside of your area, of course, if you're in Tucson or Pima County, you know where to find it. But the Elder Care Locator, which N4A operates, and I can give you the number, can help you find an area agency on aging anywhere in the country. And that number is 1-800-677-1116.
Perfect. Thank you for jumping in with that, Sandy. That's helpful. I know we use that a lot. So to bring this from a national level down to a statewide and local level, I know that PCOA functions as part of a state network of organizations. Mark, you're heavily involved as a part of that network. Can you share a little about our state network and how both separately and together we support both the core AAA roles of planning and advocacy?
Sure, Lisa, thanks a lot. And Sandy, it's so great to have you. We so appreciate your leadership on the national level, and your leadership for us. I know you've been out to Arizona and specifically to Tucson several times in the last few years, and we've been so appreciative of that. We're looking forward to having you here again at some point, hopefully not too long,
Me
in person,
too.
not just virtually. Um, so Arizona, there are actually 8 area agencies on aging in Arizona, and we're probably one of the unusual states in that one of our area agencies is actually a tribal nation. The Navajo
Mhm.
is an area agency on aging. So there are 8 of us here. We all are responsible to the Arizona Department of Economic Security's Division of Aging and Adult Services, what we call DOS. And DOS is what's called the State Unit on Aging. And so they get federal dollars. And then the Arizona legislature also appropriates dollars to support older adult services funded through the 8 area agencies on aging. 7 of us belong to a state association. We call it AZ4A. And we meet regularly. The CEOs, the directors, and our staff meet regularly to talk about policy issues, to talk about operational issues, to think through how we can better serve all of the older adults and those who care for them here in Arizona. And so we have a statewide coordinator now. She actually happens to work most of her time for PCOA, and then also for the state association. Part of what we do is we want to ensure that older adults understand, are aware of some of the issues of importance to them, both state issues, statewide issues, and then also federal issues. So that they can talk with their elected officials. I always like to say that we shouldn't imagine that elected officials know what we want them to do if we don't tell them. And so we have a statewide alert network that people can participate in, and a number of us, I spend a good amount of time in Phoenix during the legislative sessions, along with our statewide coordinator, our advocacy and policy coordinator, Maddie Bynes here. We're so pleased to be able to have her in that role. So, and then here in Tucson specifically, we are Pima County. We also work very closely with the mayor and council of the city of Tucson, and the mayors and councils of several of the towns in the community like Oro Valley and Marana and Sahuarita, and also with the Pima County Board of Supervisors. And in fact, right now on the computer in front of me, I've got a PowerPoint that we're drafting up because the mayor and council of the city of Tucson have asked me to come next week to their meeting, their study session meeting, and do a 20-minute briefing on what's happening with the COVID virus, what are the sort of emerging interests of older adults, and the needs, and to talk a little bit about how we're responding to those needs, especially with some of the virus response emergency money like the CARES Act that we've all heard about, or the Families First Coronavirus Act. So those are all things we're looking at.
Thank you for sharing about all those collaborations. That's super important. And I know that, collaboration is really the key to so much of what we do, and that we don't just serve older adults by ourselves, that we're here to also develop and support a system of services for older adults. Debbie, I know you've worked a lot with that. Is that something that you can tell us a little bit more about how PCOA does that?
Yes, we really look at the community and look at what resources are in the community, look at the social service organizations and other nonprofit organizations, who has the expertise, who can help us really deliver the services. And so we subcontract in a very formal way with agencies in the community for delivering home delivered meals or congregate meals or home care services. And as we've really developed the systems, we've also looked at what expertise, what's in the community. And I think a good example of this is our nutrition network. So we contract with Catholic Community Services and Lutheran Social Services of the Southwest and the City of Tucson Parks and Recreation to actually deliver the congregate and home delivered meals. But as we put that system together, we partnered with the City of Tucson Parks and Recreation, with County and Parks and Recreation, because they had neighborhood facilities. They had centers that were focal points in neighborhoods throughout the community and the county. So we went to them to talk about, can we have a congregate meal site in one of your facilities? And our community, our county has always been very generous. They've always worked with us in many ways. So we could really stretch our limited dollars. We could really look at how we work together to put that system in place. So our congregate meals are in those neighborhood facilities. That is all changed a little bit now with the COVID and how we've had to adapt our scope of work and how we're really doing that. But overall, within each system, you know, we've looked at who has expertise, how can we all work together, how can we make sure that the system is there so older adults always have access to what they need.
Absolutely. Thank you for that. Yeah, I know that we've mentioned that a lot of the funding for Pima Council on Aging and area agencies on aging in general comes through the federal government, through the Older Americans Act is appropriated there. But I know that state government and local funders also participate. Mark, can you give us a little snapshot of where PCOA's funding comes from?
Well, sure, just to build a little bit on what I said and what Debbie just said. So certainly that Older Americans Act funding is core and is the largest share of the funding we get. But we also do get additional funding from the state. And in fact, the state government's been reprogramming money in the last year or so that we've been able to reduce our waiting lists, and we're very appreciative of that. And so that's great. And then we also have very strong relationships with Pima County and the City of Tucson, which also fund us. And in fact, we have an interesting relationship with the City of Tucson. About 8 of our nutrition sites are in City of Tucson facilities. And we actually fund them for part of those services. And then they turn around and give us some money for other parts of our services like home repair and respite services. So we have a nice flow with the City of Tucson. And then of course we can't forget our wonderful friends at the United Way of Tucson and Southern Arizona, who fund some very important parts of our volunteer support, especially. Which we wouldn't get anywhere else. And then, of course, we can't forget the wonderful charitable individuals. We actually, we like to think that we receive more support out of the community from charitable gifts than many of the area agencies that I'm aware of. And so we're so appreciative. And that money really does fill in very specific areas where our public funding doesn't allow us to meet critical needs.
That was a great overview, Mark. Thank you. That was one of the things I really learned about PCOA that makes it unique in the community, is that we not only receive funding and provide services, but we're also give funding to other organizations and support them in providing services. So we have a really dual role there. I want to wrap up this really informative discussion by asking Sandy about her thoughts for services to older adults in the upcoming months and years, if we could even think that far ahead right now. Sandy, how do you think things will change going forward? And I ask this in 2 ways. Both, how do you see issues impacting the aging population changing? And how do you see the aging system of services evolving to meet the changing needs that we're seeing?
Well, Lisa, that is the, the question that all area agency on aging directors and staffs are asking right now. And, you are so lucky to be working in one of the best area agencies on aging in the country that really has spawned innovations that have benefited the rest of the aging network. So kudos to Mark, to Debbie, and to you, Lisa. In saying that, the changes that we're seeing nationally are probably the exact same changes you're seeing locally. We're seeing greater demand for aging services. We just did a survey of all area agencies on aging in May to see how they were responding to the COVID crisis. And what we found, not surprisingly, 93% of the area agencies on aging said they were serving new clients, people who had never come to an area agency on aging before, never thought they needed the services, but now recognize they do. And those people aren't going to go away post-COVID because those needs are still going to remain. And additionally, that nearly 70% of the existing client base of area agencies on aging was in more need of services and supports than they were pre-COVID. So the demand for services for aging and the need for the aging network is going to only grow in the future. And the issue is, as Mark was talking about, is ensuring that there is investment in those services moving forward from the federal government, which we got through the COVID legislation, but that is going to expire, and the needs are not. And then also looking to state and local governments who are going to be hit with the COVID results of the COVID crisis as well. So the importance of advocacy and also individual community groups and donations coming forward are going to be critical as we look to the future. But also from a population perspective, some of the things that we are seeing is that, recognizing that 80% of people who have dementia are living in the community already, that is going to be, that is a need that is going to continue to grow too. And I think, unfortunately, because of certain situations that have happened with nursing home and assisted living, more families are looking at ways to keep their loved ones with Alzheimer's and dementia at home. So that will be an increasing demand. The issue of social isolation has really come to the forefront. And it was an issue we knew was there before. It was a public health issue. But now, because of the COVID crisis, I think the curtains are open and people are really seeing that it is an issue for older adults to be able to engage in the community, which is particularly difficult during the COVID crisis. And also the fact that caregivers are struggling too. And I think that will be an issue that will move forward, as well as health and health disparities issues and workforce issues that have been impacted. And, in addition to those issues, we're all going to be tackling the issues that we've seen that have come to the forefront of ageism and social equity and health disparities again. But how will this change the aging network? Well, I think, in this crisis, there's been a lot of innovation, and there's been a lot of rethinking the way that we've done things in the past and how we need to change that moving forward. And, we have area agencies on aging and state units on aging and the Administration for Community Living looking at what will congregate sites be like in the future, and where will they be, and how will they operate? And the big question right now for many is, when will they reopen? Also the use of technology, because we've had to close so many in-person sites and move to virtual settings. As we move forward, how will we grow that virtual presence, but also blend that, hopefully post-COVID, with what I think is the sweet spot of area agencies on aging, which is in-person programming. And I think the other issue in healthcare is recognizing the important role that area agencies on aging play with the social determinants of health, nutrition, transportation, housing, all of those issues that are now recognized by the healthcare community as being more important, or at least as important as direct medical care, is developing a relationship between the area agency on aging and healthcare. And we've seen this really evolve very quickly during COVID around the issue of telehealth. and area agencies stepping in to be navigators for older adults in using telehealth. So there's a lot of innovation out there, a lot of change, a lot of challenge as well. So as we move forward, we're all going to be working together to look at how we can continue to match that commitment, to meet that commitment of President Johnson when he passed the Older Americans Act, is to ensure that every older adult in this country has the right to be able to live well and to live at home.
Thank you, Sandy. You know, it's definitely an ever evolving and exciting time to be working in this sector. So appreciate all of that. And thank you so much for joining us today and sharing your wisdom. It's really been a pleasure having you here on PCOA Voices and in my living room. You do such a fabulous job representing us all on a national level, and we're very grateful and fortunate for your support and partnership and leadership.
Well, you all do a wonderful job, and Mark, I promise I'll come out again as soon as I possibly can.
Great.
And Mark and Debbie, your leadership here at PCOA and locally is also greatly appreciated. So thank you for being here with me today as well. So next up, it is time for the Health, Aging, and Wellness Tip of the Week. And joining us once again, here's Marty.
Hi, my name is Marty, and today I have a little healthy idea for you. It is head movement and breathing. So we're going to start out just getting really long through the crown of your head. Let your spine lengthen nice and long, and just try to relax your shoulders and become a nostril breather, unless your nose is all stuffed up. So just breathing through your nose, lips very gently touching, tongue is relaxed right there at the back of your two front teeth. And you just kind of let yourself breathe nice and easy. Okay, and then we're going to start out moving our head. So just gently nod. Yes. Go as far as feels good for your neck. Nice and slow. I think if you do things slowly, you know, you can pay more attention to your own body's response. And then let's just say no. Side to side we go. Nice little stretch through the neck. And then we're facing forward again. Let's scrape our chin on our chest. And then sit nice and tall and let the ear tilt toward the same side shoulder. And the other side. Well, that feels nice, doesn't it? And give yourself one more time, letting the shoulders relax down and back and tilting, tilting, tilting. And let's give a nice big stretch. Relax your arms down by your side. And now let's take a head turn, but go ahead and let your whole body move. So I'm going to look, trying to see who's behind me. And then gently undo that and do the other side. Who is behind you? And nice and easy. Back you go. Shoulder circles around and move your head anytime during the day that you remember, and be a good breather and have a great rest of your day.
Thank you once again for the helpful and healthy information, Marty. I've gotten great feedback about your segments, and we'll see you again really soon. Well, you just met her in our previous segment, but now I want to spend a little bit more time one-on-one with Debbie Adams, who is PCOA's Chief Operating Officer and Senior Vice President. Welcome back, Debbie.
Thank you. Thank you for having me.
Yeah, delighted to have you here again. So, Debbie, you've served at PCOA for 34 years now, and you worked for another area agency on aging for 6 years prior to that. So if I can do math in my head correctly, that's 40 years altogether. That's really impressive. Wow. I know we have so much appreciation for all you've done for the community. And many folks in the community know this, but just to make sure everybody knows, Debbie, you let us all know a while back of your plans to retire, and today, August 14th, is actually your last day serving at PCOA.
Yes, it is. It has been a great pleasure to work for PCOA. It is such a wonderful organization, and all of the people I've been able to work with and to get to know, and all the providers in the community. But it's now time for me to transition to another stage in life, and so I'm ready to do that also.
Well, you well deserve that. Well, I have you here still. I wanted to spend a few minutes getting your perspective on the evolution of things over the time that you've been at PCOA. Is there something that stands out to you that you're most proud of having accomplished during your time here?
Well, I have seen a lot of changes in that time at PCOA, and our resources have changed, and I think right now PCOA is probably in the best situation that it has been over the years. Our community has really been responding with a lot of resources. The one thing, at PCOA, we've always had a focus on older adults. And over time, we've been able to kind of expand that focus to also include family caregivers and to look at healthy aging programs. And I think the healthy aging programs are probably one of the areas that I'm most proud of, because I was really able to take a leadership role there in bringing a matter of balance, enhanced fitness, the chronic disease self-management, those kinds of programs to the county. So older adults really had an opportunity to take those classes to work on their own healthy aging and what that would mean to them. And through all of that, also to be able to develop the local fall prevention coalition, because that was an opportunity to bring many community partners together, fire districts, social service organizations, healthcare organizations, because falling is always been noted as a major concern for older adults. And so as a community, we really wanted to look at how we might prevent some of those falls. And so that's been a lot of fun to be able to really be part of that and see the community come together to address that need.
Yeah, absolutely. I know we had Karen Ring on our last episode talking about fall prevention, and that was really helpful. Hopefully we'll be able to do more on that important topic. And all of those programs are so helpful to the community. I look forward to seeing their continued growth over the next several years. I know another area that you've spent a lot of time in is our nutrition programs. And I learned quickly when I started at PCOA that ensuring older adults have healthy food to eat is one of our biggest priorities as an organization. Can you tell us all a little about how PCOA helps the older adults in our community with their nutrition needs, and also how you've seen those programs evolve over the years?
Well, we mainly provide nutrition services through our congregate and our home delivered meal programs. With home delivered meals, we're right now serving almost 1,000 people a day with meals. It's really, as we're talking about evolution, things are really changing right now, especially with the COVID crisis, and many older adults are needing that kind of assistance in their home with food. So we are now doing, as I said, about 1,000 people a day getting meals. In our congregate settings, which again have changed right now, we serve probably about 300 people a day, and have had to change that scope of work and have people come to the center and pick up their grab and go meals, because we are not really able at this time to have people congregate with that. But the nutrition programs have always been a priority for PCOA. We spend probably close to $3 million out of our budget for those programs, and making sure that people have access to good, nutritious food. over the years, I was counting, I think we've been in 4 or 5 different kitchens, because, you know, we outgrew kitchens or the building we were in needed to be repurposed. We've also been in various senior centers, you know, various buildings where we've had those programs, and again have had to move sites as buildings needed to be repurposed. We purchased the vans for our home delivered meal providers to use, and that way we can move those vans around as different needs, different geographical needs appear. And that's always been a challenge, because I remember when we first started doing all of that with the big vans, we had to figure out how to allow our drivers to be able to leave the vans on, go into an apartment complex and deliver the meals and come back out and not find the van stolen, because that did in fact happen a couple of times where they came out and the van was on its way down the road with all of the meals. So, you know, scopes of work and how you do different services have had to change over the years. But always the community has been there, you know, to respond. We've always found very good providers to help us with those programs. Right now, really working with the community food bank and the Caridad Kitchen to provide those meals. And the one thing to remember too is that we cover the entire county, including Ajo. And so we've always had to make sure there was a working kitchen in Ajo. And we couldn't do all of that really without our community partners, especially the city and county parks and recreation.
Yeah. Wow. That's so many fun stories I'm sure you have over the years, and so much evolution of services. And yet thousands and thousands of older adults have had the food they needed to stay healthy and active as a result of those wonderful efforts. That must be really fulfilling for you. I'm sure you've had a lot of fulfilling moments during your time. I'm curious if there's something that stands out as far as what you've enjoyed most about your work here.
I think for me, it's been the opportunity to really problem solve and develop programs. You know, no 2 days really at PCOA has been the same for me. Always new challenges are being presented, and that's a fun thing to be able, you know, to really look. I've enjoyed that. And I remember, and to really look at how all of our services and programs are making a difference in people's lives. I remember a number of years back, we had a program called Service Learning. And this is where PCOA partnered with various high schools, and we had high school students going out on Saturday mornings and doing yard work for older people. And I remember one time in particular standing in the home of an older lady, and she was looking out the window at all of the young people scurrying about her yard, you know, pulling weeds, trimming hedges, raking everything up, doing all of that. And she kept saying to me, "Are these young people really here doing this for free? You're not paying them?" I said, "No, they're volunteering. They're here to do this for you." And she was like, "You know, I'm going to think differently about young people now after this experience, because I only hear stories sometimes about how young people are doing bad things in the community. And this shows me how wonderful young people can be." And on the other side of it, a few years later, I was at a community meeting, and a young man approached me and he was like, "I don't know if you remember me, but I just wanted to let you know I was one of those students who went out on a Saturday morning and did yard work with you at the homes. And it made such an impression on me. It's why I became a social worker." And so I think it really shows how PCOA and many of its programs, I mean, this was an intergenerational experience that we wanted people to have, and how all of those experiences and all of those programs really make a difference in each individual person's life, and how they think about things going forward.
Those are a couple of great stories. Thank you for sharing both of those. That really demonstrates one of the benefits of the work that we do here. If you had to pick one thing that you think is the biggest benefit that PCOA provides to the community, can you pick just one?
You know, that's really hard to do, to pick just one. I think, you know, just a couple. I think the quality of our services, we have always strived for good quality, effective programming. But I think also PCOA has always been a reputable organization. Our staff provide unbiased information when people come to us. We're not selling anything. We're really very knowledgeable. We know how to connect people to resources. And so I think everyone should really know that we should be a place to start. I mean, when there are concerns, our family members are concerned about an older adult, we really should be the place to start, because our staff, I mean, we have the best staff and they're very knowledgeable and they know how to do that problem solving too and how to connect people.
I agree with you completely. That's been my experience here as well. I'm honored to be a part of this, and I've learned a lot from you along the way to help me to really do that. So thank you for being here with me today, and just a huge thank you in general for the work that you've done over these many, many years to make a difference in the lives of older adults in this community.
Oh, thank you, Lisa. It's been an honor to be able to work for the organization and to really work as part of the community in looking at how we could put services in place.
Yeah. Well, I assure you, your legacy will live on here, and we wish you so much fun and happiness in your well-deserved retirement.
Thank you.
Bye, Debbie.
Bye.
So next up, we present another caregiver tip of the week. And once again, we are joined by our team at Pima Care at Home. This is Rebecca, Yadira, and Guillermo.
Your helpful tip of the day to keep you safe at home. My tremors are becoming more pronounced and I'm having difficulty doing everyday things. I hate asking for help with everything and I'm not ready to give up any more of my independence. Please help.
So one of the helpful items that I like is a book weight. This helps us weigh down the pages of the book so it's comfortable and easy to hold. You'll be able to flip the page, you grab it, flip it over, and set the weight on top. The next item is a device that helps you to button and unbutton your buttons. You can slide it through, put your button in, and then pull through.
Another one we have here that helps with zippers actually is a little device here. You can add these to all your zippers, your jackets, things like that, and you basically just kind of helps you zip up and zip down if you have issues with dexterity as well. Also to help open doors is these little devices for your keys. It helps, you know, insert the key, and then these here, if you can't with one hand, you can actually do it with two to unlock the door. Another device to help unlock doors is this nice little handle here. You put your hand through, you're able to go ahead and insert the key without actually touching the key and then turning to unlock or lock.
Hope this was helpful.
Well, thank you once again to our team at Pima Care at Home. I think it's super helpful to see inside of our Caregiver Skills Lab and watch you demonstrate skills and tools that are really helpful for folks. So thank you again. If any of you have questions about services that we offer as an area agency on aging, give our helpline team a call. You can reach us at 790-7262. You can also send us suggestions for topics you'd love us to cover in future episodes of PCOA Voices at voices@pcoa.org. We'd love to hear from you. Thank you so much for joining us today. That's it for another episode. I'll see you again with a new episode in just a couple of weeks. And until then, be safe and let your voice be heard. Bye, everybody.